I'm Dr. Morven McCauley, and we always get loads of questions about implant treatment, so we're going to do some quick fire of our most frequently asked questions.
What exactly is a dental implant and how is it different from a bridge or a denture?
So a dental implant replaces a natural tooth by a titanium root piece, so like a bit of a titanium screw, and then we have a crown or a bridge or a denture, or something goes in on top of that, so screws in on top. So the titanium piece is a bit like the root of a tooth.
Am I a good candidate for implants, and what factors determine that, like bone volume or health?
So majority of patients are suitable for implants, but there's a lot of factors that can affect your risk factors and sort of the prognosis of implants. And they're normally down to sort of medical, so are you a smoker, do you have diabetes? And then sort of dentally, the bone quality, bone volume can play a factor in there as well. But once you have a full assessment done, we can really go through your risk factors and how we can tailor the treatment plan to reduce those risks for you.
How long does the implant process take from start to finish, surgery, healing and crown placement?
So this really depends on your treatment plan that you have. It can vary quite dramatically. I mean, ideally what we can do is we take the tooth out, we put an implant in called an immediate implant, and we can put a temporary crown on top of that. And so you are never left with a space. So tooth comes out, implant and a temporary crown goes in. We then have a period for what fancy name for it is osseointegration, where basically the bone heals around the implant. And that normally takes from about 3 months onwards. And that again will depend on if there's been grafting or your medical history as well can play a factor in that. In general, we would say a few months from start to finish.
Will getting implants hurt or require major time off from work or normal life?
Majority of implants we would classify as pain-free. So there is obviously a healing process afterwards. So you can get a little bit of tenderness, a little bit of swelling, a little bit of bruising. But majority of patients are completely fine to go back to work the next day or the day after.